everyone, you're watching News Epicenter with me, Marya Shakil. India today crossed a grim milestone, overtaking Brazil to become the second most affected country globally by the coronavirus. Despite this surge, mass gatherings continue across the nation in form of election rallies and festivals, and they clearly pose a massive super spreader threat. This year, the Kumbh Mela, which started on April 1st, is expected to be attended by as many as 150 million visitors. Health experts have raised concerns about the mega event that it might turn into a super spreader, as in such events, a large number of people congregate and social distancing norms are mostly overlooked. And it's just not the religious events. Election rallies are happening every day, attracting massive crowds without masks or any form of social distancing. Look at these pictures. All you see are huge crowds, little social distancing, and a majority not wearing a mask. The Election Commission yesterday wrote to all the political parties, ringing alarm bells about the issue, and warned of banning rallies if netas fail to comply with the COVID-19 guidelines. Meanwhile, the CBSE asserted that board exams for class 10th and 12th will continue as per the schedule and will start from May 4th. After this, political parties and student associations requested the government and the CBSE to cancel the board exams and put in place an alternative evaluation mechanism this year, or at least postpone the exams till the COVID surge is curbed. With the COVID numbers creating new records by the day, is it time for the government to ban such potential super spreader events? Curb the gatherings to curb the contagion. Should this be the mantra, the new mantra to curb the COVID spread? And to answer that question, we don't have political guests today, but rather the best medical minds in the country who know the best on how to contain the contagion. I have on the panel Dr. Jaleel Parker, India's topmost pulmonologist, renowned virologist Dr. Shahid Jamil, and Dr. Ashok Seth, chairman of Fortis Scott's Heart Institute. And Bhopal has gone ahead and imposed curfew, which will start from April 12th to April 19th. It will be a total lockdown in Bhopal. Night curfew also in Haryana due to increasing cases. Night curfew will be in place in Haryana from 9 p.m. to 5 a.m. Suraj Bhardwaj is joining me on the phone line. Suraj, ये डिसीजन क्यों लिया गया है, ये हम लोग सब जानते हैं क्योंकि केसेस बढ़ रहे हैं. नाइट कर्फ्यू का क्या लॉजिक है?
देखिए, नाइट कर्फ्यू का इसमें सबसे बड़ा एक लॉजिक तो ये बताया जाता है कि जो कुछ पार्टीज वगैरह होती हैं, वहां पर लोग इकट्ठा होते हैं, गेट टुगेदर करते हैं, उसमें ज्यादा चांसेस होते हैं कि कोरोना जो है आपस में वो एक दूसरे को जो है काफी इन्फेक्शन होने का उसमें कंटेजियस है. तो ऐसी पार्टीज जो हैं उन पे बैन हो, प्लस जो बेवजह जो है लोग बाहर घूमते हैं, बिना किसी वजह की भी रात को घूमते रहते हैं, ये दो बड़ी वजह है जो रात का कर्फ्यू पहले पंजाब में लगाया गया था, अब हरियाणा में लगाया गया है. आज से ये होगा, आज से ही ये इम्प्लीमेंट होगा और अभी तक इसका ये नहीं बताया गया कि कब तक है. जब तक नेक्स्ट ऑर्डर्स जो है वो नहीं आते हैं, तब तक ये पूरे हरियाणा के अंदर जो नाइट कर्फ्यू है रात 9 से सुबह 5 बजे तक.
जॉइनिंग मी ऑन द फोन लाइन. अरुण, सारे स्टेट्स में लगभग नाइट कर्फ्यू इम्पोज हो रहा है, कहीं पर टोटल लॉकडाउन भी हो रहा है, जैसे भोपाल की खबर आ रही है. व्हाट एल्स कैन यू टेल अस?
Well, that's right. And, now we've just heard from Bhopal and Haryana that in Haryana there will be a night curfew from 9 p.m. to 5 a.m. in the morning, and Bhopal will be shut for the entire day till 19th of April. So this is because of the sudden spike which is coming in all these states, and no state is untouched with this spike, and therefore as a precautionary measure these decisions have been taken. Especially if we talk about Haryana, in the last couple of days we have seen a huge jump in corona cases, and therefore the meeting was also happened between the senior health officials and the Chief Minister of Haryana, and therefore it was decided that in the beginning night curfew will be implemented, and then they will be taking the next future course of action once they will sit with the Chief Minister once again. So this is something which is showing us that the increasing spike in the corona cases is something which is very detrimental, and therefore these decisions are being taken.
All right. Thank you so much for joining us. And let me go straight to the guests that we have on the show this evening. Thank you so much for your time, doctors. Let me go straight to Dr. Parker. Those visuals of congregations, both religious and political, and the cases surging. Did we fail in communicating to people about the severity of the epidemic? Is it the mixed messaging that's responsible for this surge? On one hand, we say mask up while carrying maskless rallies and allowing religious congregations.
Well, ma'am, you have to see all this in a very broad perspective, which I think is not being addressed by all of us. To be very frank, if you give me a couple of minutes, I would like to explain that we human beings cannot be changed like animals. And we have been chained for the last 9 months or more than 9 months. You can imagine the impact that it would have on everybody's mindset. Also, there is an economic slowdown. For example, if a couple is earning, one of the couple loses the job, the other one gets a 20-25% lesser pay. Where are they going to pay their EMIs? The children are in school and they don't come out for nearly a year. The impact that has got on their mindset, I don't think it will be ever erased, even if they grow up. You have grandparents who have stayed for 1 year thinking that they would get COVID, or your in-laws, whoever is at home. So when eventually they have got what I should say, that they have eventually got COVID. All these, whether it is a mass gathering of religious or of political or of marriages, etc., I think people need to understand that this is not going to help them. On the contrary, it's going to get even worse and worse. One of the experts a couple of months had said, when he was asked on Indian television, that what do you foresee the future as regards COVID-19? He said that in the Western world, it's going to end by 2021. But he said in India and some of the Asian countries, our neighbors, etc., it might extend up till 22. So people have to understand, and we all need to help one another. We have to see that vaccination is done at a very massive scale, number one. Number two is that the availability of medicines, the whole health sector is nearly fatigued and it's collapsing. The nurses are getting sick, they're leaving their jobs, the attendants are getting sick, the nursing attendants who are there, the technicians, the security guards, the RMOs, the senior consultants, all are getting sick and everybody's fatigued. I have been fatigued too. So I think we should do what is best, and we all have to come together and see to it that we, in a way, how we can fight. It's not the question of,
Dr. Parker,
just
I'm going to come back to you about the lockdown particularly that the states are doing, and also the night curfew. But before that, opening comments from Dr. Jamil. From hope in February to despair and panic in April, how long do you think the surge will last? And till May end is what the SBI report is suggesting. And there is also the sense that we could be in for a long haul till September like last year. We are also seeing certain places in which the migrants have started returning to their home states as well.
Well, we're certainly in this for the long haul. I cannot tell you how long the second wave will last. Most modelers are suggesting that the second wave is possibly going to continue till the end of May. But what is really scary is the rate at which cases are increasing. If you look at the growth in active cases, that's about 7% per day. That's a very, very high rate of increase. Unfortunately, if this rate keeps on, we will be looking at somewhere around 3 lakh cases per day. And this is what some modelers are predicting. So the question is, why is this happening? Certainly, mixed messaging, as you said earlier,
Hmm.
has played a role, and mixed messaging has played a role right from the beginning in this pandemic. Uh, you can't tell a common person on the road to wear a mask when he or she sees people they look up to, their leaders, addressing huge rallies without they wearing a mask, or the people in the rallies wearing a mask. Of course, religious congregations, as you talked about, it's all about what is the private cost of illness. The
Hmm.
private cost of illness in India has been projected to be very low, and therefore people are not following COVID appropriate behavior.
Hmm. And Dr. Jamil,
So it's really multiple things, but I'm afraid we are in this for the long haul. This is not going to go away very soon. Mutants have introduced another dimension to it,
yes, that brings me to the
and the
next
more
question
the
to you
virus.
only. Some are saying that the new mutants are more infectious but less fatal, perhaps. Hence, we see the sudden spike. Is there any merit in this argument?
They're certainly more infectious, but there is really no good data to show that they are less fatal. Uh, it it is a common thing for viruses to do that, when enough number of people are infected, virus usually modulates its virulence, downregulates its virulence, because a dead host is of no consequence to a virus in evolutionary terms.
Hmm.
Uh, so some of that may happen, but at least till now, we haven't really seen it.
Okay.
The other day, you may have seen a report from Surat where, uh, an incinerator really broke down because there were so many bodies to burn. Where is this showing, the death rate to be low?
Okay.
This is again mixed messaging. This is again telling people what is not a fact.
Hmm. Dr.
The
Said,
mutants that are coming through are definitely far more infectious, and there is now data coming through. For example, in Delhi, we are seeing that roughly 50% increased infectiousness of the virus that's circulating.
hmm.
There are projections for Delhi that the R naught, which is replication number for the outbreak, has reached 2, which essentially means that every infected person on average will infect 2 others. This rate of growth is going to lead to roughly 1.5 lakh new infections from now in the next 2 weeks in just Delhi.
Yes,
And
that's.
if 10% of those people require
Hmm.
critical care beds, we are looking at something like 15,000 critical care beds.
That's
Delhi has only
certainly
about
very, very
13,000
alarming,
critical care beds.
Dr. Jamil.
It's a really alarming
Yes,
situation developing.
yes. Dr. Said, come in on this. You know, there are several states that have gone in for night curfew. Is there any rationale behind night curfews? Do these curfews really help when people have pretty much gone about their business and have already mingled through the day?
You're so right about this question, and this has been discussed across every country. And truly, I think it's gilding the lily for, if I may say so. I don't think night curfews achieve anything at all, 10 to 5. Theoretically, it's for young people who may actually be partying and having a good time and letting their guards down. But you're so right that that's 2% of the population practically on the streets at that time. And therefore, that's certainly not the way to go. But this, clearly what is missing is the strict implementation of policies. I think we've really discussed this time and again. And we talked about well-defined policies for testing, tracing, and treating. But all that you notice that in the last 6 months, they've gradually been going down. The guards were down not just by the public. Unfortunately, the guards were down for the government as well. And testing, as you know, had dropped to 50%. It was felt often that as if we've beaten the virus and that it's gone down to so low levels that it'll never turn its head up again. it almost seems that everybody's surprised, including the government, taken aback as this has happened, and that's the speed of growth. Now, and a couple of things which haven't been discussed, which are very important to discuss,
Yes, please go
is
ahead.
that the reason it is of big concern now is for two reasons. Let alone that the guard is down, let alone that we've got these huge gatherings happening, and we all know that those are recipes for disaster, but there are two other recipes for disaster at this time. And that is that it's a variant, vicious virus, and secondly, it's at a time when the hospitals are full of non-COVID patients who are requiring their treatments. Remember, in September last year, we had one-fourth of other patients. There was no trauma coming in. There were less of cardiac patients. There were less of operations going on. And we had the healthcare workers and doctors to take care of those COVID patients as they were filling up in. Now, the hospitals have normalized to take care, and the volumes of non-cardiac patients having surgeries or interventions or trauma is exactly the same as they were 2 years ago.
Okay.
And where we now have the staff and nurses who now have to take care of both COVID and non-COVID, that's the bigger worry. That's where the overwhelming of the healthcare system may happen. So it's not just the beds and ventilators and oxygen. It's actually now going to be the overwhelming of the hospital care and the healthcare personnel, which will actually be the biggest worrying factor if this continues to rise at the rate at which it is rising. And that is the dread which we should be truly worried about. And that is why I say that we still have to be concerned about masking ourselves, the distancing, the avoidance of gatherings, because otherwise this recipe for disaster is helping our enemy, which is the COVID, and we're not going to overcome it if we continue to support it in this manner.
Dr. Parker, do you think our vaccine strategy should be revisited? Privatize it, sell it over the counter, let people buy who can buy. This way we can vaccinate a lot of people, or we widen the gap between the two doses so that more can be inoculated?
I think everybody should be vaccinated, come what may, whether it is in the private or through the government. I think the government also doing a fairly good job by trying to see that the vaccination process is taking place. And I think nobody should be deprived of vaccination. I think everybody should get the vaccination doses, because it will, even if you have COVID, it does not give you a blanket cover against COVID. But even if you have COVID, the severity will be remarkably reduced. The load on the healthcare would be reduced. Hospitalizations would be reduced. Patients would have been able to take treatment at home. I am seeing patients who have taken the vaccines. They come to the hospital, but they don't require intensive care. They might require intravenous medications. Otherwise, most of them can be treated at home. So I think vaccine should be given to each and everyone. Privatization, yes, of course, if that is done, let people buy, but the poor also should be given the vaccinations as much as possible.
So, France and Germany have started mixing vaccine doses after AstraZeneca blood clot reports came in. For under 30, they will now give mRNA vaccines. How does this actually work?
Is that a question to me?
Yes, Dr. Parker. I'll come to you, Doctor. Yes.
See, mRNA vaccines are, the efficacy rate of mRNA vaccine is much better than the, the other vaccines, which are the vector-based, etc. So if they have done a trial, I'm more than happy that they've come up with, I think, documentation that the younger generation can be vaccinated. But primarily, right in the beginning, I think we were not wrong by giving vaccination to the elderly, to the health workers, to those who were having comorbidities. And now, since everybody is going to be vaccinated, I think the younger generation also are now getting COVID. When I say the younger generation, I'm talking about the adolescent. I'm not talking about the pediatric age group, because I'm not a pediatrician, so I won't be able to I won't be able to give you a correct info in regards to that.
Yes.
But I think everybody should be vaccinated. This is my personal opinion, and I shall always, what you call, be
How has
vocal
your
about it.
recovery been so far?
Beg your pardon?
You are also a COVID.
Yes.
You had COVID in the past. How has it been after that?
Uh, well, initially, I think we were not aware of. We made a couple of blunders while treating, taking the Western world because they were ahead of us. So we were of the opinion that steroids and blood thinners, etc., plasma should be given. But over a period of time, we've become wiser. In the last 4 months, I have had only 2 deaths, and that were just 2-3 days prior. Otherwise, I had no deaths. All my patients went home on the 5th day, maximum on the 6th day if they just wanted
All
to
right.
be sure that they are better. So they used to wait for a day. Otherwise, most of my patients on the 5th day, they go back home, and I'm very happy about it.
That's
And
a
these
relief.
patients are not coming back to me with any illness or any side effects, etc.
Okay.
But yes, the ones who were treated earlier, including myself, my colleagues, etc., where we gave a lot of steroids, we gave blood thinners, etc., we all are facing those problems which are being seen after 4 months, 6 months down the road.
Okay, Dr. Jamil, uh, you know, how do we break the chain? By vaccinating as many as we can, as early as possible, is what people say. But can our manufacturers produce as many vaccines? States are already complaining about shortage.
Look, a vaccine in a pandemic is supposed to do three things. One is to protect people who are at the front line, healthcare workers, frontline workers. The second thing a vaccine should do is to reduce mortality. And it was correctly allowed initially for healthcare workers, frontline workers, and people above 60. Now it's been open to people 45 plus. The trouble that happened in India is that when the vaccination was opened, we were on a downward slope. So everyone thought that COVID has gone away. So why should I get vaccinated? Because these vaccines have been developed so quickly. They may not be safe. They may not be good. All of that. So we didn't get vaccinated when we were supposed to get vaccinated. Now we are trying to race against time and vaccinate people as the COVID curve is climbing. And this is always going to be a challenge. So the other issue is that of manufacturing capacity. See, Serum Institute can produce roughly 50 to 60 million doses a month.
Hmm.
Similarly, Bharat Biotech can produce, roughly 20, 30 million doses a month. If you look at public documents, India has produced roughly 310 to 320 million doses of vaccine between these two companies. Out of that, we have used about 120 million doses domestically, and roughly 65 million doses have been exported. So there still seems to be somewhere around 100 million doses somewhere in the country. Uh, so there really is no shortage as such. It's really a matter of logistics.
Okay.
It's a matter of how the government is paying for those vaccines, how the government is getting vaccines into the system.
Okay.
You must also remember that both of these companies are private limited companies.
Hmm.
They are not government enterprises. If you are going to ask them to give their vaccine at 150 rupees a dose, you don't find a good cup of coffee in 150 rupees. So where is the incentive for them to upgrade? Where is the incentive for them to increase capacity?
Dr. Jamil, I've really come to the end of this.
Understandably, Serum
Eh,
Institute has asked the
yes.
government for 3,000 crores to increase
I have just
capacity.
30 seconds for Dr. Ashok said. Dr. Ashok said, Sputnik V being given emergency use authorization. Now there'll be 3 vaccines there in the public domain. Do you think it'll just scale up the entire vaccination process in India?
Yes, I think we should. And this is good. This is truly very welcome. I hope that in the next 2 to 3 months, another vaccine comes in, and that is going to be vital in actually ramping up the production of vaccines. India has been the biggest producer of vaccines in the world. Everything is being manufactured here, and therefore we need more vaccines. There's no doubt. We have to open it up to younger people. Till now, the policies have been fine. We have to redefine those policies now in the wake of the second wave. This is going to be vicious, and a redefinition of policy naturally includes more vaccine, more production, and open it up to all.
All right, Dr. Ashok Seth, thank you so much for joining us. Dr. Jalil Parker, pleasure to have you on my show. Dr. Shahid Jamil, thank you so much for your time. That's all from me. Thanks so much for watching, and I'll be seeing you tomorrow.